and we'll go ahead and get started on our training session today. So thank you guys so much for, again, joining us for your Zoll training session. So what I like to do is I like to just go around the device, and I like to start on the side that we typically would use the most, which is your vital signs side. My device does not have a bag on it, just to make things a little easier for you guys to see. And in addition to that, I don't have all the cables and hoses attached to it at this time, but I will attach as we hook into the rhythm generators. So I'm going to go ahead and turn the device so you guys can see just a little bit better on this side. So what we're going to do is we'll start up from the top here. What you guys have up at the top is going to be where your 4-lead will get connected, so that'll sit just like that. And if you follow that out to where the colored wires begin to separate, you're going to see where your 12-lead will get hooked into. So these will go on just the same way you guys have been used to putting them on. Now, there's a couple of things that make this a little different. So one thing is that we can get a respiratory rate off of our 4-lead, which is kind of cool. So there are limitations to this feature, but we want to make sure you guys are aware of it so you're more successful with it. So this is going to read across lead 2. So as the diaphragm goes up and down, it'll pull a respiratory rate. Again, this is a neat feature, but we want to explain the limitations. So if you guys are bouncing down a really bumpy road, I would double check those numbers, or if your patient has really bad tremors or anything like that that would create a lot of movement, you would want to go back and check those numbers again to make sure that they're accurate, make any changes that you would need to off of those. Now, when we're on the topic of your 4-lead, we want to talk about electrodes as well. So we recommend a wet gel silver chloride electrode as opposed to a dry gel electrode where we have to wait for that gel to settle into the patient's skin, or perhaps a special procedures electrode that's a lot smaller and has a more narrow window of temperature ranges that you could use this. That's not typically what we would need out in the field when we're working outside in the elements. The other thing is just a little bit of skin prep really helps tremendously. So when we're putting electrodes on our patient, sometimes our patient has dry, flaky skin, might have some lotion or body oils on their skin, and this prevents the gel from settling into the skin to give us that nice, good tracing that we have. So what we recommend is you take a 4x4, lightly abrade the skin where your electrodes are going to go, and that will help to reduce any of that artifact that's there by helping that gel to settle into the skin and breaking down any barriers that might be there. One other thing that I'd like to mention is cable and hose maintenance. So you'll see everything's wrapped into these nice loose coils here. So that's what we're looking for when you go to package your cables and hoses into your device. You don't want any sharp bends that might destroy some of the fiber optics in any of the cables. And one other piece of information that I want to pass along is, particularly with your blood pressure hose, please make sure that you pay attention to what the operational guidebook for your monitor suggests for cleaning. So there's a list of cleaning supplies in there. We don't want you to take the blood pressure hose and dip it into any disinfectant solutions or put your blood pressure cuff inside of a washer machine. And the reason I say that is because if you take a look at your blood pressure cuff, you've got a hole that can introduce water into the cuff and ultimately into the device. So I say that because guess what? There was a service out in the United States that did that. So we want to avoid that because it can damage your device. We'll spend a little bit of time talking about your pulse ox real quick. So it is made by Massimo. If you guys are ever having any kind of difficulties getting a reading, the manufacturer recommends that you place the pulse ox onto the patient's non-dominant ring finger. That tends to be the least calloused. So you'll see, if I can get the angle right with the lighting, that there's an outline for a finger here with that dark gray line. That's how it's going to sit onto the patient's hand, just like that. The other thing is, if you guys are working in really bright conditions, a lot of strobe lights, LED lights, things like that, that's causing interference, you can take the patient's hand and shield it underneath a blanket to help you guys out with your readings. Now, in addition to your pulse ox reading, we're also going to give you one other tool in your toolbox, which is going to be perfusion index. That will come up right underneath your oxygen saturation, and it will be indicated by PI for perfusion index. You'll be looking for a number of 1 or greater to tell you that the site that you picked is a good site. Now, what are some causes that can make it below 1? Well, the patient's hand might be really cold and they might need to be warmed up, or you may have to pick a different site. Or perhaps you have a patient that's ill and they're just not perfusing very well. So just a couple of things to keep in mind. But again, perfusion index, just to recap, you're going to be looking for a number of 1 or greater to tell you you picked a good site. For your blood pressure system, so I think I pointed out just a second ago that this is made by Welch Allyn. So we've partnered up with Welch Allyn to give you the best of the best with blood pressure systems. And this is a unique system, unique to Zoll. So you're going to find that you have a threaded connection on your blood pressure hose. So just a hand-tight connection is all you're going to need. And you may notice that the tubing has 2 sides. So one side is going to push and pull air, the other side will listen like a stethoscope will. This is going to help you guys get fast blood pressures most of the time in under 15 seconds. So we can do that by taking that blood pressure on the inflation instead of the deflation. Now, if it can capture it that way, it'll get you a fast blood pressure. If it can't, it's going to take its time and take the normal amount of time that you might be used to today. We can help the system out by sizing the cuff up the right way. So think of all the things that you would want to do if you were going to auscultate a blood pressure and apply it into here, and you're going to be successful. So 3 simple suggestions. Number 1 is we want the cuff as close to bare skin as possible. And that makes sense because if we were going to auscultate, we wouldn't want layers and layers of clothing that we would try to hear through or listen through. The next one is going to be line up this white artery line marker to the patient's artery line. And the last piece is when you go to close the cuff around the patient's arm, you're going to find an arrow and these goalposts on the outside. So you want this arrow to be inside of the goalpost. If it's outside, go ahead and switch the cuff out and put the right size cuff on. So it is important to size these cuffs up the right way. So just like a manual cuff, if we didn't size it appropriately, we could skew blood pressures by 40 to 50 points. And that could sometimes mean the difference between us treating and not treating our patients. And changing the blood pressure cuff is just as simple as right there. So this will just pop on and off. One other piece that makes this blood pressure system different or unique is the ability for this to communicate with your 4 leads. So for example, we're bouncing down the road and we're really struggling to get a blood pressure reading because there's a lot of noise in the background. So we've hit a bunch of bumps in the road. The roads aren't that perfect. And now the monitor's confused. What's a beat and what's a bump in the road? When the patient is on the 4 lead, they will talk to each other. It does that by syncing to the patient's R wave. It'll look at the monitor and say, okay, I ought to hear a beat here, here, here. I'm going to ignore all the noise in the background to try to help you to get a more enhanced blood pressure reading. Now, you don't need the 4 lead on to get a faster blood pressure. It is there to enhance your blood pressure reading when it otherwise may be struggling to capture a blood pressure. Any questions at all on your blood pressure, pulse ox, or 4 lead? Moving down from there, you'll find your capnography. This is just a swinging door that goes from side to side. We're going to spend a little bit more time on that when we get to turning the monitor on. If you're wondering what this is the exhaust port to the capnography. This is nothing that we'll have to do anything with or really touch, so we'll leave that alone. I just like to point it out in case there's anybody that's curious about that. Now my device doesn't have a bag on it, so it's a lot easier for me to access my printer door. So if you do have a device in front of you today and you want to take a look at the printer door, I recommend take everything out of there to make it easier. And instead of mine just being the simple printer door, you'll have a black deflector, and that helps to take the paper. Instead of making it go in the bag, it'll push it up above the monitor, So it'll feed up to the top rather than inside of the bag. So let me go ahead and open this up for those of you who are not familiar. So this is important, the orientation of the paper. And the reason why it's important is because this is a thermal print paper. If you're wondering if the monitor is ever going to run out of ink, no, it's not. There's no ink in the device. It is, again, a thermal print paper, so the way you place the paper in matters. You're going to notice that mine is going downwards, and that's really what you're looking for. If you ever forget, there is a picture inside the door. Now, when your paper is empty, mine's just about empty, you're going to be left with just that plastic tubing that's really easy to just pop out of there. But when you're going to put a full roll in, it can be a little challenging until you've had some practice with it. There's two tabs that hold the paper into place, and it's important to make sure you've lined those up properly, and that when you place your new roll of paper in, that it's not hung up on anything. So I always like to check to make sure that there's no problems with that. I like to leave a little bit of paper hanging out, and then I shut the gray door until I feel and hear a click on that gray door. When I'm done with that, I like to take the extra paper and slide it behind that black hinge door so it feeds above the device. And when you're going to tear your paper, if you hold it straight up to the ceiling and tear to the back, that will avoid any paper jams. Any questions on your vital sign side of your device? I'll move on to your critical care side. My device probably looks a little different than yours. So what you're going to see on my device is a critical care monitor. So I've got 2 temperature ports, 3 invasive lines. Up at the top here, you've all got this. This is a USB connection. This is for software upgrades, and this is also so you can move data. So we move data through Bluetooth, Wi-Fi, USB, lots of different options that we have. And that's what that little port is there for. You can also pull your calls off of there as well if you ever needed to. This is where we're going to connect our therapy cable. So on the very end of my therapy cable, I have a white triangle. There's also one in the device up at the top. To connect the two, we're going to line those up and push. I like to check mine to make sure that there's no loose connections there. This is an important cable. I don't want this to fail in the middle of a call. So I always like to make sure it's connected properly. Now, each cable will come with a test. So it'll look like this, 30 joule test this side up. And at some point when you guys are checking your equipment, we would like to encourage you guys to check out your cable as well as part of your checkout. So it's really easy. Once you take the gray adapter from the device therapy cable and you press this black button, you're going to pull. You're going to end up with this part that has a red lightning bolt that says this side up. We're going to go to the test box that also says this side up, and you're going to connect the two together. When you do that, you would turn the device on, run it up to 30 joules, and deliver into here. That's going to be your checkout, in addition to your batteries. When you're done, it's important that you disconnect this. If you leave these two connected, you're going to get an error message on your device that says there's a short detected. So I'm going to place my gray adapter back on. Now it's code ready. And I do want to point out that your pads, even if you don't open them up, they still give you the ability to pre-connect if you choose to do so, because that little pigtail will be hanging out without disrupting the packaging to your device pads. Any questions at all about your critical care side? Okay, we will move on to the back of your monitor. The back of your monitor, you've got stretcher hooks up top. If you guys have your bag on your device, then you guys are going to have a pouch back here. You'll have a padded shoulder strap. Every device will come with this little pigtail. This allows you to charge into the wall if you choose to do so. For every minute that you sit on charge, it'll give you a minute of runtime. Now that's really nice to be able to charge up that battery. We're going to spend a little bit of time talking about the importance of making sure that your batteries actually visit a base charger though. So this is your battery. It's going to be a single battery. To check it, really simple. Press and release. The more green you have, the better. So I've been using this battery all day yesterday throughout our sessions, and then I had used it a couple of times last week as well. And these sessions again are about an hour or so long, and even with delivering energy, pacing, cardioverting, all of those things, I'm just down to those 3 green lights still. So this battery will last you a really long time on a full charge. So it wouldn't be uncommon for you guys to get 8 to 10 hours of continuous runtime if you're not delivering energy off of a full battery. If you were to press and release, and instead of seeing these green lights here, you got the red X that stayed lit, you would want to take this out of service. There's something wrong. Let somebody know. And if we press and release and we got the question mark that stayed lit, this would be an amber color. This means it hasn't visited the base charger in a long time, and it's time for it to go back into the base charger. I like to think of it going to the base charger as it getting a chance to go visit the spa for the day. So it needs to go into the spa or into the base charger periodically so that it can get a recondition if needed. So even if you've charged your device and your battery off of here and you've got full lights on your device battery, this is not a substitute for your battery visiting the base charger. Again, that's the only way that it can get a recondition. That extends the life of the battery and ensures the cells in the batteries are working properly. So you guys will come up with a rotational schedule of whatever works best so that you guys are allowing these batteries to visit those base chargers. Any questions at all on the back of the device or your battery? Okay, I am going to turn the device so that we can see the screen. So logistics questions, I'm going to encourage you to reach out to your administrative staff. I don't have those answers at this time, but after training, if you would get in touch with them, they can answer questions with respect to one of the ones that I just saw pop up in the chat room about which stations will have those base chargers. So that's something they'll be able to answer after training. I just don't have those. I'm sorry. I'm not sure. You're welcome. All right, so orientation of the device. So if you've not worked with this device before, I think most of you are pretty familiar, but if you haven't worked with it, it's pretty easy. The green button up at the top, that's your on-off button. Whenever we turn this on, it's gonna run through an operational test. And we're gonna do that in just a moment. We're gonna see lights come up at the top of the device. It's gonna check the printer door. And then we're gonna get one of 2 messages. We're gonna either get self-test is passed in the center of the screen, or we're gonna get an error message that's gonna lead us to maybe possibly taking the device out of service if need be. This device has a 2-minute internal battery. If you ever need to swap out batteries and you want to stay on the current call, you can do so. You just need to swap it out within that 2-minute window. You have a ready for use indicator up here in the upper right-hand corner. So right now I have a Ghostbusters or no smoking symbol sitting there. If we see this when the device is running off of the battery source and it's turned on, we probably have an error message in the center of our screen that we need to pay attention to. So again, that's your ready for use indicator. I'm going to place the battery inside of the device and you're going to watch that Ghostbusters symbol go away. And I'm going to go ahead and turn this on. We're going to watch that operational test. So it's a little hard to see with the lighting, but you can probably see the reflection of the different lights that are coming up. It's checking my printer door. And I have a self-test as passed here. So I'm just going to adjust my camera just a little bit so we get a bit of a better view here. All right. So all of the buttons on this side make it so easy because they all have a picture. And the picture tells us exactly what the button push is going to do. So the bell makes things quiet. Home takes us home. These are our navigation keys that move around the screen just like a mouse on a computer. The circle will be our enter or select, camera for record, and blood pressure. The opposite side, these I treat like apps on my phone. Whatever the icon is the app that we're going to get into. And just like your phone probably has several different pages of apps, we give you a back arrow key that allows you to access the different pages of apps. Down at the bottom is all the energy. You have a pacer, analyze for an AED, energy select number 1, number 2 charge, number 3, which will illuminate, is your shock button. Now this device is going to give you both an adult and pediatric AED, and it's the only device on the market that's going to give you both. So that's kind of a neat feature that we'll talk about in just a moment. I'm going to connect my 4-lead into the device and into the rhythm generator. So we can run through a couple of different options. You may notice that we're in pads view right now. When I connect my 4 leads up to the rhythm generator, it's going to automatically switch over to lead 2. So basically whatever you guys are connecting first is what it will switch over to. In this case, I'm going to do the 4 lead. So it'll switch over to lead 2. If I had pads, it would stay in pads view. So there's that auto change. And we talked a little bit about that bell button that makes things quiet. So that bell, again, is going to be for your alarms. And right now, the only alarms you guys are going to encounter are going to be associated with an equipment issue. That will be a yellow light on the top of the device with a corresponding yellow message down below. And I can replicate that by just pulling off my 4 lead. I get an ECG fault, yellow light. I can't get to it right now because I'm busy. I can silence this temporarily and I can either also fix it, but I get a green check mark there that lets me know that I've acknowledged it. I'm going to go ahead and fix the problem so that the yellow message goes away. The house will take you home. So it'll also give you 3 different screens. The first screen is your waveform. Second screen is a vital signs trending window. And the last screen is my favorite. It's a large numeric display. So it makes all those numbers a lot bigger. So just to recap, you get a waveform, vital signs trending window, larger numbers. Those are your 3 screens on here. Your navigation keys, I told you, move around just like a mouse on a computer screen. So if I press one arrow, it goes in one direction. The other one will go in the opposite direction. I know it's early, but I'm gonna teach you guys a little rhyme that helps me to remember this. So anything that you can highlight blue, there's something you can do. So as I move this cursor around, all these areas that I can highlight blue, there's something I can change. I'm gonna go up to the top where it says adult. I wanna make this a pediatric device. I'm gonna highlight it blue, press enter. I'm gonna scroll down to pediatric, press enter. And now we've changed 3 things on the monitor. We've changed the amount of air pushing and pulling through the blood pressure cuff. 42 different alarm parameters in the background. And more importantly, we just took our Joule settings down to 50 to start. So this is good for the AED, but in addition to the AED, in manual defibrillation mode, when you're doing your weight-based calculation, you are closer to that area because you're not starting from, say, 200 joules and having to work your way down. So it just keeps you closer to that area, so you're not having to press the button so often. I'm going to switch this back to adult, and I'm going to show you guys how to turn your device into an automatic blood pressure. Anything I can highlight blue, there's something I can do. If I go to NIBP mode in the center of the menu here and highlight that blue, I see the word manual. I press enter, and now I can switch it to auto. I'll press enter, and I can change the interval by going down one button push, enter. I want to take this every 15 minutes. It might be a little difficult to see, but in that blood pressure window, I've got auto every 15 minutes right now. That's just a confirmation. I'm going to switch this back to manual mode. It removes it from this window as well. And I'm going to press the home button to get out of there. Any questions at all on how to move from manual to automatic and vice versa? We can add leads on here as well. Again, anything I can highlight blue, there's something I can do. I'll go to the, not the button push of the Roman numerals, but the actual one that's on the screen for lead 2. I'm going to press enter, go to insert, and I'm going to add lead 3. Press enter. I can change the size. So if I highlight this one, it goes corresponding to here and also to this one here. So we can change the size. And I can go back and actually remove lead 3 by going to the lead 3. I'm going to remove. Any questions on the navigation keys? All right, we'll talk about your camera button. The camera button, you're going to hear me emphasize a lot because I want to make sure I'm really driving this point home of the importance of this button push. This is your record button. If you're like me, and I worked on a life pack almost my entire career until the very tail end, so I always had my presenting rhythm automatically record. So this is a little bit different. We don't do that on this device. If you guys need a rhythm to populate onto your report, you've got to press this button push. It will not automatically record that presenting rhythm. Now, it will automatically record your 12 leads and when you deliver energy, but let's say you've not delivered energy and you didn't do a 12 lead. If you're not hitting this button push, you're not going to get a rhythm strip. So that's important to do. So we've talked about this being a record button, but I also want to talk about the other feature, which is the Back to the Future feature that it has. So if our patient is in a nice sinus rhythm and they get a little excited and they do this, but we're not close enough to the monitor to hit the record button, they cough and they convert on their own, and we want to prove that it was there, we're going to press our snapshot key. Now we can hold up to 4 different waveforms on the screen. And when we go to print out our snapshot, you will find a camera symbol at the bottom in the center, and this is the exact moment that we hit that snapshot. Prior to that is 12 seconds, and after that is another 12 seconds for a 24-second strip. So record and back in time 12 seconds and forwards in time 12 seconds for a 24-second strip. Now, if you are recording and you press this button and you want to stop the print, you can always hit this roll of paper and press the roll of paper from printing, but still store into the memory of the device. So if I press this and I don't want the paper, I just want it to store into the memory of the device, I can press the roll of paper to stop the print and still record into the memory of the device. Blood pressure, we've already talked about, but again, it's good review. We want to make sure the blood pressure cuff is as close to bare skin as possible. We want to make sure that we line up the white artery line marker to the patient's artery line. And when you close the cuff around the patient's arm, make sure that that arrow, which is just below that, is inside of these goalposts. Now, I've got a question here. So let's see what we've got. I think it's related to our snapshot. How do you get the stored snapshots to print? So you have a couple of options. So you have a storage file, which I haven't shown you guys yet, and I'm going to show you guys when you get into the app side of your device. But you also have the ability to print a current snapshot if you didn't already print it. So if I press my home button and I go back to my vital signs trending window, you may notice that I have two camera symbols inside of here. These indicate a snapshot. Remember, anything that you can highlight blue, there's something you can do. So if I wanted to print this one, I scroll to the bottom of the menu, I highlight this blue, I press enter, and now this allows me to move inside of the vital signs trending window to pick whichever one I want. Now I can press enter and then follow the prompt to print. Since we're on this page, I'm going to show you one other thing. So I just pressed home a few times to bounce out. Now, instead of highlighting blue at the bottom, I can highlight blue at the top, press enter, and I can print out all the vital signs from here. And that will look something like this. I'm going to press home to get us back to our waveform. Any questions at all about any of the button pushes that we've talked about on this side? I'm going to move on to the app side of our device, and I promise you when we get over to that storage file on this side, which will be on the second page, I'll also show you how to retrieve those if you've shut the device off and you need to get it. Yep, I'm going to go over that in just a moment. I just saw that in the chat room actually as I was explaining that. We are going to show you how to retrieve those after the device has been turned off. We can absolutely do that. So that'll be when I get to the second page of the apps here. I'll be able to show you guys that. We're almost there. Those are good questions. I am going to attach my 12 lead. The Roman numerals on this side, this will change your top lead. I'm going to stay in lead 2 for right now. I want to do a 12 lead, so I'm going to get into the 12 lead app. When I press that, I'll get my live 12 lead in real time. So we'll see elevation in 2, 3, and AVF. And the nice thing about this is whatever you see on the screen is what your printout will be. So if you see a bunch of artifact, you know to make those corrections before you try to acquire. So I can pull off a lead to show you exactly how easy it is to locate where those concerns or issues might be. It is important that we put age and gender into the interpretive statement software for the device, and we can do that by going to the second button push. It'll default to a 45-year-old male. You can change this by using your navigation keys. I pressed enter. This works just like a digital clock. If you press and hold, it'll go faster and faster. Now, we don't require a name, but age and gender, again, are important for the interpretive software of the device for your 12 leads. So it is important to put that in. We'll press the home button, and this is the point where we want to confirm that our picture's good, that we like what we see. And then we come over here to the 12 with the camera, press that, and we're acquiring. If you're wondering why we give you a stop sign, this is in case your patient starts to move excessively. Maybe they start having a seizure in the middle of your acquisition, and you know that you're going to have to throw this away because the printout's going to be terrible and unusable. So we give you the option to stop the acquisition so that you don't have to waste time and paper. Your 12 lead will print out with an interpretive statement. It'll move on to your numerical values, your 12 lead picture, and at the very end, mine looks a little bit different than yours. I've stacked 3 different leads, 2, 3, and AVF. I believe you guys just have 2. So I've got a 10-second strip in diagnostic mode for 2, 3, and AVF at the end. Now, if you want another copy to pass on to somebody, you can press the roll of paper and that will give you another copy. And if you're wondering why we give you 2 different screens, you'll notice up at the top here, this is real time. So we're continuing this 12 lead in real time. The one over here is the one we just printed out that we turned into a book. So this is kind of like a Kindle reader on this side. First page of my book is my interpretive statement. The purple arrow will flip the pages of the book. There are my numerical values. This is my side-by-side. So I can monitor my patient in real time with any treatments that I give to see if any changes have happened. The blue circle just above that toggles us between our V leads and our limb leads. So just to recap, the purple arrow is your page flipper, blue circle will be your view changer, the roll of paper, that gives you another copy. I'm going to press my back arrow key. The green check mark that you see here, this is the archive specific to your 12 lead. So we're in the 12 lead app. Everything related to your 12 lead will be in the 12 lead app. So the archive sits right here. We hold about 32. We get rid of the oldest to make room for the newest. You don't have to clear the memory. It'll do it on its own. The newest one will always be sitting up at the top. Any questions on how to acquire a 12 lead, put your age and gender in, or access your archive? To get out of your 12 lead app, you can either press home, or I prefer to just hit the exit 12 button. Capnography is next. So we give you a couple of options with your circuits of what you choose. So this is one type. You also have a nasal cannula option as well. We always encourage you to start from your device first and work your way to your patient last. So this orange piece is where we're going to start with, and this is going to get hooked into your vital signs side. So this is going to be a 1/4 to 1/2 turn to the right. And after we've connected it to the device, we need to turn this on. So again, just a friendly reminder for anybody that worked on a LifePak. Typically, this would just populate automatically. We on this device need to activate the button push. So this is an important learning curve that I had to remind myself of when I was switching devices. So we're going to activate the button push. 2 ways to confirm. You get the green circle right here. And then more obviously, you get that purple channel. So this will initialize, and we'll get a couple of question marks that'll pop up. In addition to that, we will get this to zero out. Now, these are single patient use. They're disposable. So when you're done with your call, we're gonna have you guys throw these away, put a new one on when it's time to do so. So there's my zero. So we color in the waveform so it's easier for you guys to see. We'll give you your capnography value up at the top, and the BR will be the patient's breath rate. We have a purging feature. So if the device senses there's something in the line, maybe it's something like vomit or blood, it will try to reverse the pump to clear the line. If it can do so, it'll go back to monitoring your patient. If it can't, it'll say, instead of purging, it'll say occluded. And at that point, you would want to change that line out. So there it goes, it's back to monitoring my patient because it was able to clear the line by reversing that pump. To turn this off, you press that CO2 button, and you would turn the circuit in the opposite direction to remove it. We have a white cross here. These are code or treatment markers. So if I press this, you're going to see 5 of these here. So we've got a generic med button, a CPR button, and a generic treatment button, a couple of different options. We have the ability to hold 10. These are the 5 that everybody kind of settled on, that they felt this was kind of the most important for you all to use. I did want to point out, if I back out of here, where we put the CPR button was so that if you guys were really busy, we didn't want you fumbling to try to find it. It's just right where your finger would otherwise be at. So treatment button, CPR, to make it easier to find. I'm going to skip sync and come back to it. The roll of paper, remember, it's a little deceptive. It is not a record button. This is my record button. This is a start, stop, print. That's all it does. If I press this, you will not find it later. Paper makes paper. The camera saves into the memory. Do you guys have any questions for me about any of the button pushes on the first page of our apps? Again, we're going to come back to sync in just a bit. If your treatment buttons are not the same, that just might be that your device hasn't recently had the most recent configuration file added to it. Don't worry about that. I know they're working on making sure that those configuration files are passed on so that they're uniform to everybody. So I'm sure that that's going to be something that they will take care of soon. We just actually finished up that configuration file, so we've tweaked a couple of things. Mainly it was the treatment and code markers that everybody settled on. So those will come out to you soon. I'm going to press the back arrow key. That little half-eaten cookie up at the top will change your contrast. Now we're going to go into that storage file that we were talking about. So remember, I came over here to my home button and I was able to pull my vital signs trending window. Well, this is up here when my call is current. When the device goes off for 2 minutes, this has to go into a storage file along with the entire call. So I always think of log as my storage file. The very top button is my treatment summary. This is all the stuff that you've done on your call, any energy you've delivered, 12 leads that you've delivered, any treatment buttons that you've pressed. We hold about 150 or so cases, depending on the file size. We'll get rid of the oldest, again, to make room for the newest. Newest will be up at the top. Now I want to show you guys a shortcut. So if I wanted to print the very top one, all I have to do is press enter and then find the roll of paper instead of scrolling all the way down to print treatment summary. So if I've only got 2 or 3 cases in there, it doesn't matter. But once you guys have been using these devices for any period of time, you're going to eventually hit that 150 mark. I don't want to scroll through 150. So all I have to do is press this roll of paper after I've selected which one I want. I'm going to press home. And we talked about where would we find our vitals. So our snapshots, 12 leads, energy, code markers, so forth, are going to be in the top button. The vitals are in your print trends. Same thing, if I select that top one, all I have to do is find the roll of paper, and your printout will look something like this. I'm going to press home to get out of that menu. Do you guys have any questions for me about any of the button pushes on this side? I'm going to press your back arrow key. We got one question. The treatment summary only prints a list of events. So the treatment summary should do more than just a list of events. It'll give you, it won't just, maybe I'm misunderstanding the way that I read that. So it'll give you your rhythm strips as well. So let's say that we defibrillated somebody. It will show that defibrillation. It will show a rhythm strip. If you did a 12 lead, it will show that. If you took a snapshot, it will actually show the rhythm strip. And at the very beginning of that rhythm strip, it will show also the timestamp for everything that you did. And I see somebody says that they do not have that showing up. So what I'll tell you is maybe 1 of 2 things is happening. Perhaps you've got older software that perhaps needs to be updated or upgraded, or you may not have gotten the most recent configuration file that should standardize all the devices. If you have issues moving forward after we've looked at both of those options, either the software update or the configuration file, please let us know so that we can help to troubleshoot those issues. But one of those 2 things should resolve it. And then for those of you that are not looking at the chat room, Michelle was nice enough to say that they are working diligently to get the updated software and standardized configuration across all of the regions. So that's being worked on. They're hoping to get that by the end of the calendar year. So it's a little work in progress. Any questions at all before we move on from this page? I'm going to back up a little bit more and we'll get to our energy. I'm going to go back and connect my therapy cable, and I want to point out something really quick, just in case you guys are using or come across a different style pad. So if you come across a pad that has a 3-prong like this, try to get the angle of the light so you guys can see. So there's the 3-prong. You can leave your gray adapter on, and you'll notice the little lightning bolt with the notched end. That's actually where you can plug right into. So it will end up looking something like this. So we're going to get into the energy now. I'm going to start with your AED. So your AED is the Analyze button. It's really easy because all we have to do is press it and follow the directions. So that's what I'm going to do here. Press Analyze.
Clear. Press Shock.
This illuminates when it's ready to deliver.
Perform CPR.
And then it's telling us what we should do. We should be performing CPR. We've delivered energy once. This is our clock, so we know when to switch out compressors. I started off at 120 joules. It auto escalates 150, then 200, and I'm in adult mode. Now, one piece that I haven't shown you, which I'm going to show you at the very end, is going to be your CPR feedback using your Cpr Stat pad. So you would additionally get a display on here that will give you a dashboard for CPR feedback as well. We'll show you guys that in a little bit. That is specific to adult patients. You will not get that with pediatric pads. I want to make this a pediatric device. I'm going to go over to adult. And if you pay attention to the joule change, we give you that purple color and turn it down to 50 joules. Any questions on how to activate your AED or switch it to pediatric? I'm going to switch this to adult, and to exit my AED, I'll look for the exit button in the upper left-hand corner. Manual defibrillation is just 1, 2, 3. So energy select, charge. I'm asking for 120. I'm going to deliver. My next energy is 150. We're auto escalating. I've delivered energy twice. It gave me 133, even though I asked for 120. Don't get hung up on this number. It's going to document both the 133 and the 120. If you're not familiar with this, it's customizing the energy for each patient. So if we look at all the patients that we've encountered throughout our careers, they're all different shapes, sizes, heights, so forth. So when we deliver energy that's a dosage, we want that dosage to be the same regardless in this instance. So we don't want to cheat anybody out of what they otherwise may have received. This device is going to customize that energy for each patient. And the reason it does that is it's taking into consideration any impedance within the chest wall that might slow that energy down or decrease the energy rather. So as the energy travels from the pads to the heart, which is the target, it's going to encounter things in the way, organs, bone, tissue, muscle mass, so forth, that might slow it down. So instead of diluting the energy that it otherwise would have received to the patient, to the heart, we're going to customize that energy, taking into consideration those things that are standing in the way to give the patient the true 120 that we ask for by the time it's received at the heart. Again, you won't have to get hung up on that number in green. It'll document both in the background for QA, QI purposes for those high impedance patients. You're going to document whatever you requested, 120, 150, 200. Any questions on manual defibrillation? We're going to show you how to disarm the device if you've charged it up. So I'm going to press the charge button twice. It's going to ask me to hit it one more time to confirm. The disarm button will be here on the left. If you don't do anything, it eventually times out, but it gets really annoying because it'll give you a very high-pitched sound at the last 10 seconds, and that'll happen at about 60 seconds by the time it times out. We'll move on to cardioversion. The sync button is on the left here. When we press that, we see all of our different markers on the screen. Now this time, when we go to charge it up, it's going to give me a message reminding me that I have to press and hold the shock button to deliver, which is a little different than when we defibrillate. Because we're timing it at a very specific point, we need to press and hold the shock button to deliver. So I'm going to change my Joule settings down to 100, charge this up. This is saying, hey, press and hold the shock. Now I can remove my hand, and there it's calculating the impedance through the chest wall again. Any questions on the button pushes for cardioversion? We'll move on to pacing. Your pacer button is down at the bottom. I think of this as a heads up display. When I press it, it pulls up the menu. When I press it again, it removes it. From here, really easy two-step process. So the first one is really obvious. We want to tell it to start pacing. So scroll down to start pacer, press enter, and I get a confirmation, the blue line that I have here, and then blue pacer spikes that are across the screen as well. Trying to get the lighting just a little bit better so you guys can see that. So from here, that was our first step to turn it on. We're now going to go to the output and we'll increase the milliamps. So this goes up by 10 and down by 5. So I'm going to press enter, and I'm looking for a blue pacer spike in front of every green QRS. And I'm slowing my button pushes so that I'm giving the heart enough time to respond. This is what your electrical capture will look like. So I've got a blue pacer spike in front of every green QRS. Any questions on how to activate your pacer? Now this has a safety net built into it. If you have a patient who's really diaphoretic and one of their leads were to come off, some devices will just shut the pacer off, and then we lose capture and it's not a good day. This has a safety net built in the event something like that were to happen. If a lead comes off, which I'm going to do right now on my rhythm generator, it's going to yell at me. I'm going to make this quiet for just a moment. Yes, I've got a lead fault, but if I pull this menu away, I'm going to see what I've asked for. A rate of 60, milliamp 70, I want to be in demand mode. But this is telling me there's a fault and pacing is now overriding in fixed mode. So that's just saying, hey, I can no longer see the picture. I know it's a little difficult to see, but we still have blue pacer spikes on the screen. There's no tracing on the screen. So it's going to default to the orders that we've last given and keep marching out so that you don't lose capture. Any questions about that? To turn it off, you're going to press your pacer and go to turn pacer off. The last part that I have to show you guys will be your Cpr Stat pads and your Cpr feedback that you'll be able to receive with the Cpr Stat pads. As I'm setting up the next rhythm generator, you can use this as an opportunity to ask any questions that you may have. And for those of you, if you maybe were a little bit later to log in, if you didn't already do so, If you could please put down how many individuals are at your location. I'm just keeping track of a head count. I won't need any names. All right. So we'll start with your pads just to show you guys what they look like. This is a real set of pads if you haven't already had an opportunity to take a look at these. There's a purple. It gives you a picture of how you should place this onto the patient. And then the other piece is in red. And that also gives you a picture along with the CPR puck that's attached to it. Now, I just want to bring your attention to the picture here because it's a little deceptive. In the picture, it makes it look like these two stay attached, the puck and the red pad. But in the real world, we really want you guys to separate them away. They're designed to separate. They each have their own independent cable, and it's actually perforated and designed to separate away. This has adhesive on it, just like the pads do, so it'll stick to the patient's chest in the same place the picture shows, basically where your hand would be for compressions. So if you guys are doing anterior pad placement, you're gonna follow what your picture shows. But if you're doing posterior pad placement, so front and back, the red pad on this pad is the one that gets moved to the back. So red to the bed or red to the rear is how I remember it. So that's only if your protocol discusses front and back pad placement. If it doesn't, don't worry about it. Just follow whatever your protocol tells you. You'll notice that we're in lead 2. The minute I touch the energy or therapy buttons down at the bottom, it switches over to a pads view. So this always stays nice and code ready for you. So when we take a look at this, we're replicating what we would be doing when we're doing manual CPR. It's just a bunch of artifact on the screen. Doesn't give us a whole lot of information as to anything that we're doing right or wrong that we may need to do a little bit better. So when you place the puck onto the patient's chest and you begin doing compressions, it's an accelerometer. So it's going to take into consideration what you're doing and guide you through the process. So your first 5 to 8 compressions, those are going to be free. You'll get a dashboard. The first number is your depth. The second number is the rate. The bar is the recoil velocity, which is how fast we're coming off the patient's chest. The diamond is the perfusion to the patient's heart. We want to treat this like a video game. We want to keep the numbers green and the diamond filled. When the number goes yellow, make the correction.
Push harder. Push harder.
It's yelling at me to push harder.
Good compression.
When I fix it, it tells me I did a good job. One other piece of information we want to bring to your attention, which is going to be your filtered rhythm. So we can filter out about 90% of the artifact through a compression to show you what the underlying rhythm is, so that we can reduce our peri-shock pauses and our time off the chest. So if we're at our last 10 seconds of compressions, we would encourage you to charge this up come off the chest to confirm, is that shockable? If it is, deliver. If it's not, disarm. And then we want you to get right back on the chest again so that we keep that diamond filled. This is just emphasizing the importance of making sure that you have that pump primed for the heart and that you're doing good compressions. When we stop, it'll take 10 seconds for the diamond to deploy, and we get just a gentle reminder saying, hey, you've been idle for however long it's been. And the reason it's not yelling at you is you may be moving your patient down a set of stairs or through tight quarters, and we don't need this machine yelling at us during those times. Do you all have any questions for me about your CPR feedback or any of the things that we've covered today? So I'm going to take that as a no. What I will tell you is if you think of something, please reach out to Michelle and let her know whatever your question is, and I'll try to answer that question for you to help you through whatever it is that you need assistance with. I will tell you there's an additional video that we shared also, which emphasizes the importance of skin prep and making sure you guys are putting the right electrodes on. I didn't realize the importance of it when I worked in the field because nobody taught that to me. And it wasn't really until I came to work for Zoll that I understood the importance when I started visiting all these different services throughout the world and just understanding how best to troubleshoot things. So I hope that this session today was helpful. Again, it is recorded. When the links are available, I will email those to Michelle and then she can disperse those out to you guys. So thank you so much. Have a great day and be safe out there. Thank you.